Hey, dear, you ready to bring them in or?
Um,
Right.
well, I know that so where, so the PowerPoint will be.
So I'm gonna put it up on the screen.
Okay,
They're gonna be able to view the PowerPoint while you
okay.
go through it. Is that
Yeah.
okay?
Yeah.
Hi,
Hey, Christy, good morning.
good morning. Looks like you've already got it recorded.
Yes, ma'am.
Okay.
We're gonna give it a couple more minutes, see if anybody else joins, and then we'll get started.
Okay.
And
Are you want to look from this right here, or you just want to look here?
Pretty much go here.
Okay,
Charles Smith was one of my patients, so.
gotcha.
Thank you. Poor Ellen.
Alright, we'll give them till about 11:05.
Okay. Hey, Charlotte,
Hey, Dr. Buckley.
how are you?
I'm fine.
Good.
I wanted to hear what you had to say. Actually, I just wanted to hear you, so.
That's sweet. Yeah. I'm having a great time.
Well, the thing about retiring is I miss you as an audiologist, but I'm happy for you that you got to retire.
Right. Yeah. Yeah. Well, they still keep pulling me back in. So I come up here and I talk to Paige and, meet everybody. And so it's been fun though. I have four grandchildren now
More to
so
read to.
that two with each, two daughters and four grandkids, two with each one. So I do a lot of that stuff. And I guess this is part of my talk, though. I shouldn't start that yet.
You ready to get started?
Yeah.
Awesome. I'm gonna share my screen real quick. Can everybody see my screen with the PowerPoint on? Awesome. All right, whenever you are ready, Dr. Buckley.
Okay. Well, I was an audiologist here for about 12 years. As some of y'all may know, some of you may not. And before that, I worked in ENT practices for 37 years. So maybe not, no, let's see. I retired, I started in 78 and I retired in 23. So 45 years. Anyway, you do the math. But anyway, I've learned a whole lot being in ENT practices. I'm very glad that I did that at the beginning of my career. And pretty much that was the only choice that was out there when I first started. There weren't really many private practices. There were hearing aid dealers. Audiology didn't even have licensure back then. It took a while for us to even be able to have licensure. I had to get a separate hearing aid dispenser license initially to be able to sell hearing aids, which was fit hearing aids, which was kind of different. So anyway, I'll go into that a little bit more. But since retirement, I've been being a grandma. I've been I put my newspaper. I still, some of you may know that I teach ballet and I'm still teaching my classes and doing some performances. I'm doing a lot of exercising and working out and, dealing with a few health issues, which I guess comes with the territory, comes with age. But anyway, all in all, it's great to see my family, my husband, and I've got 2 daughters. I have 4 grandkids now. Little girl, Laura is 10 and Colin is 6. He just turned 6 a couple of days ago. Bruce is the cutest 3-year-old that I think of on the planet today, of course. And then Clark is the darling, almost 10-month-old. And he's such a good baby. I mean, I'll watch him. I'm going up to help watch him when we get out of here, which I got to do right on time. But I'll be with him for like 3 hours, and he never cries. He just is happy all the time.
That's awesome.
It's great. It's fabulous. So anyway, they do say that whatever um, you wind up filling up all your time no matter what it is you do. So that part's true. So, so hearing loss, what I always told my patients as I was, seeing people and getting them acclimated to using hearing instruments. That hearing loss, it's not an ear problem. It's really a brain problem. It's communication, quality of life issue. It's one thing to treat hearing loss, of course, and when you live with it, both of my parents they had some hearing impairment. It wasn't terrible. My stepmom, which I was totally amazed at, she was this very, very, pulled together artistic lady, and she came to me sometime in the 1980s and just said, I'm having trouble hearing. I need to get some hearing aids. And I'm kind of like, really? Because back then, it just, a lot of people didn't do well with them. Technology wasn't what it is today. But anyway, so she was a fabulous hearing aid instrument user all the way through the rest of her life. She died at 96, 97. My dad was another thing. We finally got him his hearing checked and got him hearing aids, and he was not interested in as many other things. He didn't really feel that he needed that, so couldn't get him to do it. My mom, she also had some decreased hearing and did use hearing instruments and was very, very good about it. My 97-year-old stepdad, who was the last of the Mohicans, they're all gone now, but he never had hearing loss. He had died at like 96, I think, and we kept checking his hearing. His hearing was not the problem. He had Parkinson's, but anyway, so so I have it in my I mean it's genetic some, and I started noticing I guess really a little before I retired that I was having trouble hearing my husband. I'd be laying in bed with one ear down, on the pillow, and he'd say something to me, and I'm like, I'd lift my head up and I could actually hear. And of course, binaural hearing is better than monaural, but so when I had gotten my hearing checked from time to time, and maybe a couple of frequencies were starting to maybe decrease a little bit, but not much. And then so I started noticing more of a change, and started using hearing instruments. So the whole thing of learning to listen, and it's not an easy thing to learn to listen. You've got to really focus. So let's see, let's go. And just knowing that it was never, I mean, what I always told my patients, it's never going to be like when you were younger, unfortunately. So feeling out of the loop, you're listening, but there's gaps. You're not getting the beginning of the conversation. You'll say, oh, they're talking to me, as having to ask others to repeat. You heard what they said, but you're not getting enough critical information to be able to put together, or you think you know what they said, but that wasn't it. Yeah. And then, of course, one of the hardest things, and what I went through a lot with my patients, is their family members they've got hearing aids. They should be hearing perfectly now. Well, I'm afraid that's not that's not the case, you know, I mean, we're treating, you know, this will make improvements, you know, perfection is not a realistic goal. Improvement is, but perfection, you know,
It's not like a fix-all kind of situation.
no, I mean, it's not gonna, and actually, and what I used to tell my patients, we're not fixing your hearing loss. Unfortunately, because once there's damage in the auditory system, you know, and there's some things going on now with gene therapy and things that they're in the developing stages of, but I don't think it's gonna happen anytime in our lifetimes, you know, but you can't fix hearing loss. Cayden has cochlear implants.
I do.
With something like that, there are fixes because we're bypassing the auditory system. We're going directly to the auditory, you know, nerve, the auditory pathway to get that sound in there. But with hearing instruments, you're altering sound to directly stimulate the sensory fibers in the cochlea. And the big problem is that the sensory fibers in the cochlea are damaged. And so you're trying to send sound into a damaged auditory system, and it's not fixing anything, but it is providing more stimulation so that what gets to the brain is going to be better. And it takes time to stimulate that brain and get the brain to be able to understand what it is that it's getting. I've equated it to an exercise program in a lot of cases. You know, when you first start an exercise programs, it hurts and you don't like it and it's boring and all this and that. But as you go along, you start to notice that, oh, I'm feeling better. You know, things are moving more like they should, or hopefully that's the situation. And and that's kind of the correlation I used to have for acclimating. And it's not going to happen overnight when you start exercising and you know, you're not doing everything that you want to do right at the very beginning, but stick with it. You keep going. Hey, Jane, I just saw you jump in there. How are you? Okay, let's see.
It's all about consistency.
It's all about consistency. Yeah. Okay, let's see. I think I've kind of already went over that. And I think I talked about that. I'm constantly filling in the blanks. It gets tiring. I mean, you're using up energy that you could be using for something else, you know, in the brain, they've got so much energy, but if you're using it all on trying to listen and communicate, it takes away from other things that you need to be doing.
Well, I've even noticed that, you know, wearing my cochlear implants, like at the end of the day, I'm just drained. I'll
Right,
take them off, you know, I'd rather be kind of in silence
right.
after wearing them all day.
And not have to focus so much on
Paying attention or listening to every detail.
Yeah, it is. It can get very, very tiring. So, hopefully using hearing instruments or using your cochlear implant, I mean, it's bridging some of that gap, but there's still some of that there.
Yes, ma'am.
So the emotional impact, people get frustrated. You're embarrassed to have to ask people to repeat things, and I go through that, especially with my little ballet students. I teach 11, 12, 13, few 14-year-olds here and there, and I also do little children when we do the Nutcracker once a year, which is fun. So I got these little bitty soft voices, Miss Gloria, you know, and it's just like, what they say? And I'll have walk over to them, and sometimes I still can't get what they're saying, and that is very frustrating. So, you know, then asking them to speak up, you know, they don't really know what you're talking about when something like that goes on. And asking others is to tell my patients, ask people to slow down and speak more distinctly. and they'll remember it about 5 minutes, and then they'll go back to what they were doing before. So a lot of times you have to keep asking them
And
to
reminding.
do that, reminding them to do that. But that gives the brain a chance to process what you're hearing, and that makes it better. Feeling just out of the loop, that everybody's talking around you and you're not able to take part in the conversation because you're not getting it. You're not getting what's being said, or missing so much of it that then you'll say something that has nothing to do with what they were talking about, and then it's like, ooh,
After you kind of isolate a little
yeah,
bit.
yeah, or they're looking at you like, what? We didn't say that, So, oh goodness. All right. Talked about that. The sound, everything says it's gonna sound different. Sounds sharper. It's not completely natural sometimes. In fact, this morning when I was getting ready and put my hearing instruments on, I had opened the doors this morning because it was so nice and cool outside, and I was like, oh, I hear the birds. I hadn't heard them until I put my hearing instruments on. So yeah. Let's see, go back and slide. There was something there. Oh yeah, yeah. The other thing I've been doing since I retired, and I used to do this some, I grew up playing the piano, and I've been trying to get back into playing the piano again with varying degrees of success. But anyway, wearing my hearing instruments and playing the piano is very difficult because I'm getting some weird harmonics. I need to talk to Dr. Gainey and get a music program or something, because it's really strange, and it's almost like
Unnatural almost.
yeah, well, and it's almost like I can hear someone else talking, and of course I stop playing and
Listen.
talking about. So that's really strange, and my patients used to tell me, especially the ones that were musicians, that things just didn't sound quite right with their music. My brother wears hearing aids, and he's a musician, and and we worked on things like that, but without having that experience, that was something that was very difficult to, or more difficult to deal with, because it was almost a trial sort of thing.
And that Gloria, like, I'm so excited to add my music to some of those. Music is hard. You're teach.
Yeah, it's totally
music
different.
program will definitely solve that.
Yeah, it can help. Yes, and I'm looking forward to getting that put on there.
Sure.
So, and then remembering to change it.
It's very old.
So, and the whole thing that getting used to hearing aids, it's definitely a process. It's like me practicing the piano. The more I do it, the better I get. But even though I did it way back in the day, when I started to sit down and do it again, it was kind of like starting over again. Fortunately, I remembered how to read music, but so it's a process. It's not an event. It's not something that, oh wow, you put them on and everything sounds great. You gotta work into it.
Of course.
So, and even knowing all that, it took me a while to do that. So, okay. The biggest myth that a lot of people have heard, or they're wanting to believe, is that hearing aids restore normal hearing, and unfortunately they don't. I talked a little bit about that already, that you can't fix the auditory system. There's damaged auditory fibers, they don't grow back. The brain even does this, it's this neuroplasticity thing that we talk about, that when you start using hearing instruments, the brain is figuring out how to get some of that back together, because and they've equated it some to like phantom limb. If you lose a finger, if you lose, some of the fibers that would be neural fibers that would have been innervating that part of the hand, they migrate, they go somewhere else. And it's kind of the same way with the brain when the temporal lobe is not getting the stimulation that it needs, the auditory fibers, they have a tendency to kind of move and go, they go do something else. And that neuroplasticity of getting those fibers back to where they're doing what they're supposed to do, it definitely takes time.
Pretty much opening up the auditory picture,
Yes.
providing that stimulation.
Right, getting that stimulation going. So, one of the biggest reasons for consistency of using your hearing instruments and then not waiting too long to do it. So, and of course, as everyone with hearing instruments knows, even with the very top of the line technology, it's not going to eliminate background noise. Nothing will eliminate background noise. We help control the background noise, and then your skills help you to be able to get more information through that background noise. And a lot of that depends on how much hearing loss you got, what's going on, which frequencies are you having difficulty with. So everybody's different as far as that goes. Okay. Follow-ups. You got to get things reprogrammed, just like, with the music thing, how we set them at first. It's kind of a little bit of a jumping off point, and it's based on, of course, what your audiogram is. It's based on what your real ear is showing. But then from there, being able to tweak that information based on the information that the patient is giving you. And that was one thing I felt that having the experience that I did, that I was reasonably good at. And but listening to people and trying to figure out how to transform what they're telling you into something that's going to, programming wise, it's going to help them with hearing instruments. And then also talking to them about what's normal, what's reasonable, what's to be expected, what's unreasonable, but it's that whole adaptation thing too, is that how you do in the beginning is not necessarily how you're going to do once some time.
It also gives us time for their brain to adjust to it.
Absolutely. That's the whole thing. Yeah. Because hearing it's brain driven. We're not getting as much stimulation. It's got to relearn the patterns. So, it all takes time. All right. So, of course, looking at people when they talk to you and getting them to look at you, honey, please don't talk to me as I'm walking down the hall. You're walking down the hall, trying to reduce the background noise, turn the TV.
This area.
Oh, sorry.
You know, and
They're all embedded in.
oh, they said she kept telling, she think that gets get better. So she should make sure that. Sorry.
No, you're okay.
Yeah,
You said-
they're all they're participating right now. I don't have any more entries. Okay.
What about that one? Is there one more there?
What are you talking about?
What that little red thing is right there? Oh, Jim Clayton. Okay.
Yeah, we have a one.
Okay.
I'm not sure. Let me see what the chat's saying.
Okay. Okay. How often should we do that? Really, I used to tell my patients about once a year or so, or if you're noticing changes, if you feel like you're just not doing as well as you used to, it's a good idea to have your hearing rechecked. Also, we're big on maintenance here. It's one of the biggest things. Bring your hearing aids in, get them clean. I used to have a lot of people come in, they're not working. They're just not working. And we check them, and sure enough, something's either not working or they got wax in them, they need to be cleaned, something along those lines. And so coming in for your regular cleanings are really important.
Very important.
But yeah, about once a year, or if you notice something big changing, I'm just not understanding as well as I used to. That's kind of a red flag to go ahead and get it rechecked.
Of course.
So,
Also getting them sent out for service too. That's
well,
like
yeah,
one
at
doing
least
with
once
the
a year.
specs.
Yeah, well, because things happen, I mean, stuff gets in there. It's just sometimes horrifyingly amazing, you know?
Yeah.
We would get a report back from the manufacturer, you know, they open up the hearing aid. There's, you know, how something that's sitting behind your ear winds up with earwax in it, but it does, you know, skin cells, dead skin, hairspray, just
Lotions.
lotions, yeah, hands, I mean, our hands. I tell my dancers, you know, don't put your hands and pretend you got a little tutu on and you don't want to put your hands on your tutu. Hold them a little away from your body because your hands have oils on them and you wind up with dirt all over your tutu, you know. So every time when you handle your hearing aids, you're transferring some stuff to it, and I know it's disgusting, but such is life.
It is. Most
Oh,
definitely.
goodness. Okay. The other thing is advocating for your needs. You go into a restaurant. Please don't sit me in the middle of the restaurant. Noise all around. Let's get a booth. Let's get somewhere where we're going to be a little bit more away from the big, you know.
Have a wall,
Yeah.
preferably. You know,
Yeah.
or
Or let's don't go there. I know that it's always noisy and they play the music at top volume. I'm not going to be able to understand what anybody's saying. You know, let's go to this place where, you know, it's a little bit muted. You know, maybe they're not quite so crowded, or let's go earlier before they get too busy. Things like that to make sure that you're able to enjoy the situations that you're in. Yeah.
it's a good advice. Show up a little bit early. Or a big crowd.
Yeah. Yeah. Better for your digestion anyway.
That's true. That is true.
Oh, goodness. Okay. So one big thing, and this wasn't really with me getting hearing instruments, but it's come up to me when I first started out. As I said, I was in I was in various ENT, ear, nose, and throat physician practices, which I really felt like that was the best way to do it. You got a doc right there. You know, if they had wax, you can clean them out. At that point, that was not part of our scope of practice. But as time went by, you know, the big problem with ENT practices was you're basically at the beck and call of the ENT.
Yeah.
So, you know, you're doing a hearing test, we're seeing kids, we're making swim molds, you know, we're doing this and that, and constantly being pulled away. And if someone comes in with a problem with their hearing instruments or called in, you know, the front desk would, you know, I'm hearing it. I'm sorry, you're gonna have to talk to Gloria. She's busy right now. Can I take a message? You know, I mean, it was just
Hard to fit them into.
cut off, you know, yeah. And so then, and I'd have to get them in, and just something as simple as buying batteries, you know, because the front desk people, their focus is on the ENT. It's not on the audiologist. Yeah. So anyway, that was frustrating, and having to work around the ENT schedule. So then when I came here to private practice in 2012, every person here in the office is dedicated to helping the patient. If you call in, they're going to do everything that they can to help you, including getting to the audiologist, but you can bring your hearing aids in. The front desk you can walk in, they can do it for you, they can get it cleaned, you know, at least, I don't know what the percentage of the time, but you know, a bunch of the times you're having probably my hearing aid's broken. It's broken. I used to have a friend. It's broken. It's not broken. It just needs to be fixed. And they look at it, and sure enough, your dome is clogged up. Your filter needs changing. It's something that's going to take 10 minutes, and you're on your way and back to your normal life.
Yeah.
And so,
So y'all didn't do much cleanings at the ENT practice you worked
well,
for?
I was the one that did it, you know, but they had to get in and see me, you know, and I couldn't I mean, every now and then I could have someone come in but generally they knew they couldn't just walk in.
Gotta be
You know, you had
scheduled.
to have you had to be on the schedule, yeah. And I did a lot of other, when I first started off in ENT, I worked for a lot of physicians that did balance testing. And so I was seeing patients that had dizziness and postural, issues. And I mean, those tests took, several
Mhm.
hours to do. And so, my my focus was on many different areas. Hearing instruments being one of them, but it wasn't the only thing I was doing. So when we came here, it's all about helping people with decreased hearing. And of course, I was very thankful for having worked in ENT because, of course, they teach you there's red flags. There's like 8 red flags that there are, that you learn when you're in school that you look for, that if the person has this, they need to see the ENT. They see this, and the last thing, the reasons for decreased hearing, the last one was always God only knows.
Mhm. That's true.
You can't always rule everything out, but having the inside knowledge to be able to see something and say, oh, I've seen this before. This is a cholesteatoma. This is I see a perforation, which you're trained to look for in audiology, but it's just different when you see it in a day-to-day practice like an ENT has, So anyway, I'm very glad that I had that experience, but I'm very glad that I was able to end my career here because it was the best thing. So
That's awesome.
yeah. Okay. So, technology is part of the solution. I guess that's one of my end things. I think I'm gonna have to step over and do another thing. All right.
Do we go ahead and go to the next one?
Yeah.
Okay.
Pulling this together a lot quicker than I was going to. The big one of the things that's going on right now, there's some advances in audiology, some legal changes in the state of Arkansas and Maryland. Audiologists are able to order imaging now. They're able to some drugs to be prescribed for I guess for ear infections, for different things. I'm not really sure all of the details
Wow,
of
that's in
that, but
Arkansas?
that's something totally different than what's possible in Texas, and pretty much has been the scope of practice. And ENTs have kind of fought this some because they want to keep control of a lot of that stuff. But in a lot of instances, we'd see something and we'd have to send them to the ear, nose, and throat physician, and sometimes they just bounce them back to us. And, that's another Medicare visit. That's another thing that they're having to, put towards their deductible or pay for out of pocket. And just trying to get the best thing for the patient without having to have a bunch of, side steps right around it. For the longest time, and I think this is still valid, that one thing that we always recommend is that you have your ears checked by an ear, nose, and throat physician before you get hearing aids. But in a lot of instances, it's not necessary. It's not needed. We know that this is not an ear infection. You don't have fluid behind your eardrum. There's not a perforation. There's not wax in your ear, or we've cleaned that wax out. It's a nerve, what they used to call a nerve type hearing loss. And I had one doc I worked for the longest time. He called it, most of the time we call it sensory neural, which it's sensory of the sound and neural, but he called it neurosensory. Not sure exactly why, but yeah, he called it neurosensory. But anyway, and sensory neural or neurosensory hearing loss just basically means that it's something to do with the way the brain perceives sound, with the sound getting through. And there's some different iterations of that. There's such a thing as auditory processing disorders that the sound is getting in there. We're not measuring that people are not hearing certain sounds, but the brain is not able to process that information. This happens a lot of times with children that are having language disorders or trouble in the classroom, things like that. So, there's different things like that it's going to require something else other than just the hearing instruments, but it's
They
not
do help,
something.
though.
Oh, absolutely, yeah. But it's not something that they can do surgery and correct. There are certain kinds of hearing loss that you can do surgery and correct. So with those, I would always see that and send it to the ENT, of course, which is what you're supposed to do. So
Yes, we will.
um, let's see. All right. Yeah, and the care and the follow-up and the consistency of use, all those things are at least as important as the hearing instruments that are recommended. I I used to have people come in and, well, my friend down the street, this one really drove me crazy, was, Joe Blow down the street, he never wears hearing aids, so they're not gonna work. Are you Joe Blow? No. But then also, my friend or my sister got, hearing instruments brand X, and she's doing really good. So that's what I want. It's like, if you went with, somebody had the same shoes that you were going to go buy their shoes, but your feet were completely different.
Every patient's different.
Every patient is different. What works for one person might not necessarily work for another. And, someone who's doing really, really wonderful with their hearing aids versus someone who's maybe not doing quite so well. But, there's reasons for things like that. And it's not always something that we or the patient can control, unfortunately.
Yes,
So,
ma'am.
anyway, exercising your brain. Yeah. I've also, some of you know, but and I had this before I came here. I had 2 hip replacements on the same hip, but the first time around, I hadn't done my exercises. I hadn't done. They really didn't have it as far as back then, and PT was almost non-existent. And this
Huge
time
challenge.
around, yeah, I mean, it took me a long time to get better, although I did, but this time around it was something very different. But they had you do exercises before it was done. There was PT for, so a couple of months afterwards. And I mean, I just spun through that, and the consistency
Yep.
and doing what I was being told to do was a lot of it. And I kind of equate that to hearing instruments too. If you do what you're supposed to do,
Of course.
um,
It's a process.
yeah, it's definitely a process. So, not like turning on a light switch.
That's true.
Well, if it was just that easy. All right. Wow, we kind of breezed through this here. Does anybody have any questions? Tammy, hey.
You discuss balance and hearing aids.
Discuss what?
Balance.
Oh, balance and hearing aids. So the balance system, of course, the inner ear, it's, there's the cochlea and then there's the vestibular system, and it's kind of like two halves of the same whole. Seventh nerve it controls how your face moves, and it controls some of your balance. And the eighth nerve controls hearing, and it also can control your balance. And can be a lot of different auditory things that go along with balance, but not always. We used to get people would come in and pretty much everybody had Meniere's disease, which was not the case. It was kind of the label that they would attach to any kind of balance disorders. And of course, Meniere's disease, it results in a certain type of hearing loss and extreme dizziness and decreased hearing and,
nausea.
all those terrible things. And, but helping you cure better, it can help with your balance, but it's not everything. Exercise classes, PT is something that can really help with your balance. But it's all part of the same system. There's, what we call benign paroxysmal vertigo, which is, it's a change in the fluids in the inner ear from certain positioning. You turn your head a certain way, and it causes these thick fluids that are normal, that are running through both the cochlea and through the balance system, through the three semicircular canals, make you feel dizzy. You turn your head a different way. You go through a procedure called the Epley, and it kind of gets everything back into where it's supposed to be. With other things like Meniere's, that can actually destroy some of the sensory fibers, unfortunately. And sometimes they'll do what they call a shunt procedure, which they make an opening in that in the vestibular system to allow some of the pressure from the Meniere's disease to dissipate, so that those sensory fibers aren't being, destroyed from pressure. So, but they're definitely related. Does that make sense? And did I answer any of what you were trying to figure out?
Well, I was wondering, I assume that wearing hearing aids helps with the balance. Is
It
that
can.
correct?
Yes, I think it can. Yeah. And also it helps
Okay.
you more, since you know more what's going on around you. That helps, because if you're not aware of your surroundings, your balance can be off. And so being more aware of everything that's going on around you helps you to maintain your balance better.
When I lost my hearing, I lost my balance as well. I would take, PT, I would take balance classes just to be able to walk.
Oh,
I
yeah.
was so unsteady on my feet when I lost my hearing.
Yeah. Yeah. Oh, yeah. And yours was meningitis, right?
Yes,
Yeah.
ma'am.
Yeah. So that affects many different things, but yeah. Yeah. And of course, balance is, they say that's one of the big determining factors in longevity and health longevity. Can you stand on one foot? Can you how long can you stand on one foot? Different things. That's something that they address in a bunch of the exercise classes that I take, which have been very helpful for me. So yeah, they're definitely related. And hearing instruments, yes, they can help. Is it going to cure it? Unfortunately, no, but it can definitely help.
Great question.
Yes, yes. All right. Anybody else? Hopefully.
Takers.
Well, thank you, all of you that came in to see me talk, and it's good to see people that I hadn't seen in some time. And if you think of anything else, you can call and make an appointment with Dr. Gainey. If you have something that you personally needed to ask me, we stay in pretty close contact. The other thing I'm doing a lot of is traveling. The picture that's up right now is Paige, my friend Lynn Candler, and we were in London, and Paige happened to be there at the same time that Lynn and I were on a trip coming back from this was last year, so we had gone into some of the Lakes District in England and going back to Scotland this year, and so
That was beautiful.
and it's gorgeous. It's beautiful. Yeah. Anyway, and if you need to make an appointment to come in and get your hearing instruments looked at, call and make an appointment with Dr. Gainey. And then how do they do the gift card?
I am gonna go do a drawing real fast. So I got all the names and go do on the other computer real fast.
Okay.
I'll be right back. Can you hold them up for one
yeah.
more moment?
Sure.
Awesome. Sure. Sure, that miss anybody. Perfect. Okay, everybody. I'll be right back.
Okay. Oh, goodness. I woke up this morning, I was surprised to see, or yesterday, I had gone to get my grandkids from school and walked over to get my granddaughter and got back and came back and was playing some games with her. And my daughter came in with her son who had to go to do his 6-year-old checkup. And it was like, whoa, it's 65 degrees out there. This is really something. So enjoying the cooler weather, needless to say, which I know won't last forever, but we live in Texas. What do you expect? Oh, goodness. Do y'all come to, I know Dr. Gainey does this every month, and I was really pleased that she invited me to come and talk. But I know there's a lot of interesting speakers and things that she's able to bring up. So, I know you get the emails from this. So I'm hoping that I helped enrich your knowledge and good to see everyone. And hi, Jim. I just saw that you had come in. Or I guess you've been here for a while, but anyway.
Gloria, it was 41 degrees here this morning. It's chilly.
Whoa. But you're in Nebraska, right?
Right. We're up to 52 now, so yay. And tornadoes all around. It's fun.
Oh, wow. Oh, I would prefer not to have that, that's for sure. But we've had some weird, I don't know, I shouldn't say it's weird weather. It's Texas, for crying out loud. What do you expect? Oh, goodness. Well, you're looking good. I hadn't seen you in a couple of years, Tammy, so.
You look good too. Look like you're having a good time.
Yes, I am. I definitely am. We're coming up to the end of another year of teaching classes. We're doing the ballet Capella this year, and which is just, it's an old ballet. Got some good it's a good comic ballet.
When will that be? When will they put it on?
It's going to be June the 6th, and at McFarland Auditorium we do our big ballets at the end of the year at McFarland at SMU. And we have 8 graduating seniors this year. We got one going to Columbia, we got one going to Penn State. Not necessarily in ballet, it's like one's doing neurophysics and just, got some smart kids, which is very cool. Got one who is going to be an apprentice or trainee at the Washington Ballet, and one going to SMU. So,
All right, so
Charlotte
won the $25 gift card.
Hey.
You can give us a call or just come on up here and we'll give you the card. It has to be at the Glen Lakes location though. She's sitting here.
Well, that's good to know because I usually go to the location at Mockingbird and
yeah.
Gloria.
Come over here. They got a nice office over here. Lots of parking.
Yes.
Not blocked in like they have us over at Abrams now.
That place is always busy over there too.
Oh yeah.
Sure.
Plus that coffee shop.
Mm-hmm.
Of course, it's nice to have it there.
It is, yeah.
But yeah, definitely makes the part a little bit more difficult, so.
Yes, ma'am.
So, anyway, all right, well, thank you, everyone, I'm so glad everybody came in.
Gloria.
And,
If anybody would like a recording of this presentation, you're always welcome to reach out to us. I can email it over if you'd like to rewatch it.
I'm reaching, Cayden. Would you send it to Tammy Davis, please?
Say that again, Tammy.
what you said.
Would you send me a copy? I came in late.
I'm reaching. So,
Sure, Tammy. I'll definitely send it to you. No problem. Yes, ma'am.
all right.
Thank you, guys. Y'all have a
Thank you
great
very
day.
much. All right. Very good, I hope.
Yeah, you did great. Gosh, a lot better than I be able to do. I'll tell you that.